Hello again, everybody. This is Robin from GPAS again. People are signing in quickly, so I want to say again hello and welcome. If you've just joined us, we are going to be starting very, very soon in just about a minute or so. If you're having any technical problems, please feel free to type that into the chat box. It's on the left-hand side of your screen. I'll be happy to help you out once we get started. I will also type some information in the chat so you can watch for that there.
Oh, this is wrong. Oh, okay, that's why.
Well, let me ask Denise and Kelly and Dr. Pilny, is it okay with you if I go ahead and get started while we've got the final people signing in?
Sure, if you
Works for me.
Okay. Great.
Works fine.
Well, perfect. Kelly, you okay too?
Yep.
Great.
Can you hear me?
Yes, I can.
Okay.
Perfect. I want to say hi and welcome to everybody. I know we've still got people signing in, but I want to go ahead and just go through some general housekeeping stuff while those people are signing in so that we can get started because we've got a lot of great information for you today. But again, I'm Robin with Global Federation of Animal Sanctuaries. We want to thank you all so much for being here today. We appreciate it. We've got a great presentation planned, so we're excited you can all be here. We are recording this webinar, and we're recording it so that you can go back and view information at another time if you'd like. If there's other members of your organization that you think would benefit from this information, they can definitely take a look at that recording also. So watch your email. In the next couple of days, we will send you a follow-up email with a survey, with a reminder about the materials I'm going to mention in a moment, also how you can access the recording of this webinar. We will also send you an email about part 2 of this series because as you've probably seen, this is a 3-part series. We're getting ready to schedule the second part, so we should have information about that in the next few days. So please watch your email for that also. As I mentioned before, your phone lines are muted. That is only to help with distraction from background noise because we have so many people on the phone. But please, if you have a technical problem, type that question into the chat box. If for some reason you're only on the phone and can only hear me but you can't access the slides, go ahead and send an email to me at Robin, R-O-B-I-N, at sanctuaryfederation.org. Let me know what the problem you're having is, and I'll try to help you out via email, but definitely stay on the phone and listen to the presentation while we're doing that. Other technical questions, you can type right in the chat. Also, our presenters are more than happy to field your questions, so please type those into the chat box as you have them. There may be some we might pass along during the presentation. A lot of them we may end up holding until the end, but we do have some time for Q&A, so we will make a note of those questions. If for some reason we have too many questions and we can't get to them all, we're going to definitely make a note of them and we'll be able to get back to you via email after the presentation. So again, one more time, just want to mention your phone lines are muted, only to help with the distraction from background noise. Please feel free to type into the chat box if you have any questions at all. I'll help you out. And if you're only on the phone line because you can't access the slide, go ahead and send me an email to robin@sanctuaryfederation.org. So it is now my pleasure to go ahead and pass this over to the Executive Director of Global Federation of Animal Sanctuaries, Dr. Kelly Heckman, and she'll get us started. Thanks, Kelly.
Thank you, Robin. Very thorough explanation of everything. Hello and welcome to everybody to our first webinar of our 3-part, nope, not there yet. 3-part avian protection webinar series, which is sponsored by Global Federation of Animal Sanctuaries, or I'll call it GFAS for short, and organized by the Avian Welfare Coalition. I'm Kelly Heckman, the Executive Director, as Robin mentioned, and for those of you that have not heard of the work that GFAS does, we are an international accreditation organization that evaluates sanctuaries, rescue centers, and rehabilitation centers all over the world. Unfortunately, as a lot of us have experienced, not all facilities that care for captive animals are equal. There's no regulation that would prevent a private owner, a roadside zoo, or first-class organization from describing themselves as a reputable sanctuary or rescue. Therefore, GFAS was founded in 2007 by leaders in the animal welfare industry, including representatives from Humane Society of the United States, World Animal Protection, formerly WISPA, Captive Wild Animal Protection Campaign, and Born Free USA. And since then, we have generated standards of care and operation for 25 different groups of animals in which we evaluate any organization that applies to determine if they meet these standards. Okay. It is our goal to promote the activity of those organizations that are accredited by us, that do meet our standards, providing them with opportunities such as access to grant makers and donors that use our accreditation as a seal of approval. We promote the development of these organizations through educational opportunities such as webinars like today's, which support their ability to meet and exceed our standards. We also seek to eliminate the cause of displaced captive animals through public outreach. We use opportunities like the one today, which is being attended by an eclectic group of people representing a variety of interests, to share the challenges of animal displacement. We hope to increase awareness of the issues and reduce the need for sanctuaries in the future, but also make sure animals receive the care they deserve in the short term. So as I mentioned, GFAS is primarily an accreditation organization. We evaluate 3 types of organizations: animal sanctuaries, rescue centers, and rehabilitations for any type of animal except dogs and cats. As most would expect, part of our standards deal with humane and sustainable animal care of animals, but we also include many other issues which contribute to the issues that drive the need for sanctuaries and rescues in the first place, and are indicative of facilities with the ethical operations such as ethical fundraising, acquisition and disposition of animals, prohibition of commercial trade of animals and their parts, prohibition of any breeding unless part of a bona fide release and reintroduction program, and also prohibition of invasive research. So to qualify for accreditation, a new organization must meet all of these conditions.
Kelly?
Yep.
I'm sorry, we're getting a little bit of dropping of your words. I don't know if you're close enough to the phone or maybe too close.
Mm-hmm.
Oh, okay. I will vary that link, but let me know if that continues to be a problem.
Okay, thank you.
So with this series of webinars, you will learn about the humane care of avian species that are critical to meeting our prescribed standards. For GFAS, we want to be certain that any accredited facility meets the best practices in housing, physical facilities administration, nutritional requirements, veterinary care, well-being, and handling. Therefore, you can be sure that any GFAS accredited organization will have a full understanding of the needs of the birds and their care. As such, if you are an animal shelter or facility that receives displaced birds, we recommend that you develop a relationship with your nearest GFAS certified avian sanctuary or rescue, so you already have a point of contact to ask questions or support placement in the future. But the reality is that until you're handed off those birds, that you will need to have a better understanding of the needs in order to be able to be prepared for the birds that come through your doors. And that's what we're hoping to accomplish through these webinar series. So for GFAS, our objective in sponsoring these series is first to provide you with the necessary information to provide short-term care for the birds. We also want to encourage some of you that run avian sanctuaries or rescues to begin the application process to become a certified organization. You can learn more about our standards and the application process on our website, sanctuaryfederation.org. We also hope to support networking between those of you in the sheltering community with accredited sanctuaries and rescues. It is better to build those relationships now before you find yourself in a crisis situation. And in general, support the responsible placement of animals at qualified organizations. We want to put an end to the growing problem of displaced birds, and to do this, we need to be more mindful of where we send the birds that come through our sheltering facilities. So with that, I want to hand over the presentation to Denise Kelly of Avian Welfare Center, Avian Welfare Coalition. And Denise is the president and co-founder of AWC, an alliance formed in 2000 to raise awareness about the plight of parrots and other captive birds and to serve as an educational resource. Among the resources they provide is a handbook, Captive Exotic Bird Care, a guide for shelters, which was a handbook co-sponsored by ASPCA and Born Free USA, which provides a lot of helpful information for caring for exotic birds in a shelter setting that you all might appreciate. Denise has been the organizer for this webinar and the complimentary workshop series, and I will let her take it from here.
Thank you very much, Kelly, and welcome. I'm delighted everyone could join us today. I wanted to thank the Global Federation for hosting the webinar, and also a special thanks to Kelly Heckman and Robin Mason for their work in coordinating this presentation. As Kelly mentioned, we formed actually in 2000 to create a voice in the animal protection community for parrots and other captive birds with the goal of raising awareness to the issues and to serve as an educational resource. One of the key goals we had was to address the growing need for shelter and sanctuary for displaced birds. We believed then, and certainly do now, that working with the animal protection community and engaging their resources was a very necessary component. And to widen our reach to help birds in need, that educational resources to improve the standards of care for birds in shelter organizations and sanctuaries was integral. So we founded an avian outreach initiative to do that, and as Kelly mentioned, that includes our handbook, Captive Exotic Bird Care, a guide for shelters, our avian care workshops, which we have presented at shelters and at humane conferences, a series of downloadable how-to guides that are available online at www.avianwelfare.org/shelters, and finally, bringing these resources online via this avian care webinar series. All of these initiatives are intended to serve as guidelines for caring for birds in the short term, in shelters and other animal care facilities, as well as in other less than ideal circumstances, recognizing that most cat and dog animal shelters are operating already under enormous challenges and not necessarily equipped to deal with captive birds. For those of you who are more experienced with birds, be assured that the Global Federation and AWC supports far higher standards for permanent sanctuaries and in private homes. And as Kelly has already outlined, the GFAS accreditation process is rigorous and intended to provide accountability along all the aspects of animal care and sanctuary management. The focus, again, for this series is to better prepare facilities that care for birds in the short term in a shelter setting and to ensure that each bird is placed into the best possible and most qualified situation for their specific needs, whether that be to a permanent sanctuary or into private hands. I also want to mention that for all of the topics we will be covering throughout the series, we do offer a how-to guide on most of the topics at avianwelfare.org/shelters that will provide more details on those specific topics. Lastly, regardless of how we all might feel about the birds in captivity, and there's plenty of opposing opinion, we have an ethical responsibility to take care of those already here to the best of our ability. So let's get started, and I'd just like to cover a few facts. Again, this is our disclaimer that this is for short-term care. These will be the topics we're going to be covering in this Part 1 series. And just to go through a few basic facts about parrots and other captive birds. They are the largest population of captive wildlife held in private hands. To remember that these are the native species of other countries, that parrots and birds are not different breeds like dogs and cats, but we're talking specifically about parrots now. There are 352 recognized species. So they're actually different species, not different breeds. They're not domesticated, so many of their behavioral and physical needs remain intact even if they're bred in captivity. Most species, upon coming to a shelter, you may not be able to tell if they're male or female. The exceptions would be budgerigars and eclectus parrots because they have distinct coloring, but most of the time when they come to a shelter, you're not going to basically know if they're a male or female. They are prey animals, and that requires vigilance in the wild to avoid predators, so it's important in a shelter environment that they not be placed near predatory animals, cats and dogs, to help manage their stress levels. Expect a fight or flight response. This is pretty normal. As a prey animal, they have to avoid predators in the wild, so perhaps in a shelter situation they're going to be a little more skittish. They also have a tendency to mask illness. That's another survival instinct in the wild. So sometimes a bird entering a shelter, you may not look sick right away, but there are other signs which Dr. Pilny will go into. They are very intelligent animals. Their intelligence has been compared to dolphins and primates. They have longer lifespans. I think I need to go to the next slide. Longer lifespans than the average cat and dog. Medium to large parrots can live 25 to 80 years. They also have higher metabolic rates, which is an important factor when considering supportive care, again, which Dr. Pilny will be covering. They're very sensitive have very sensitive respiratory systems, which increases their susceptibility to toxins and chemicals. So cleaning products used for cats and dogs in the shelter can be very harmful to birds, and we'll be going into more detail on that in part 2. Fumes from overheated Teflon and nonstick emit odorless fumes that can often be fatal to birds. So things like space heaters, which you would not expect to have Teflon coatings and are sometimes used in shelters, you might have to rethink that in the bird room. They are not routinely spayed and neutered. So unlike dogs, cats, and rabbits, this is very important to the placement process, and you must end up relying on other population control measures to avoid accidental or intentional breeding once that bird leaves the shelter. Fewer legal protections. Birds not bred for research are technically covered under the Animal Welfare Act, but there are no specific regulations in effect. And the other factor is that most birds are often excluded from other animal protection laws, which in turn adversely affects efforts by humane enforcement to get relief for birds kept in inhumane conditions. I'm now going to turn this over. First, these are just some of the common species kept in captivity in the U.S. Passeriforms, which includes canaries, finches, and mynas. Basidiforms, which will be parakeets and budgerigars, cockatiels, conures, Quaker or monk parakeets, your African grays, Amazon parrots all fall in that category, and your columbiforms, which are pigeons and doves. More photos of some commonly kept species in the United States. And here are some considerations for any animal shelter that is currently not taking birds, but may be thinking about the prospect. Resources. Number one, you'd want to start to connect with some avian experts, rescue groups, bird clubs that possibly have adoption programs, and product suppliers. You'll also need to consider the space that you can allocate, how many birds you can safely house, including the separate quarantine areas. Training. Your staff will need to be instructed in the care of birds and handling of birds. Housing and nutrition. Need to start to consider the kinds of enclosures and caging, food, necessary supplies that you'll need to keep the birds. Safety, toxicity, escape from predators, and other environmental hazards, as we mentioned before, chemicals and things around the shelter that will have to be considered in order to safely house the birds. Specialized veterinary care and quarantine. Birds do require specialized avian care, and some of the providers you will be able to find through the Association of Avian Veterinarians, and I would strongly suggest any shelter that is looking to think about housing birds is to set up a protocol with a veterinarian specializing in avian medicine. And then developing a dedicated avian placement program, because it will differ, the criteria will differ from cats and dogs, and you will need to find reputable quality care and placement partners that you could work with to help place the birds, and also set up a foster home network. These are just some of the considerations. There's plenty more. I'm now going to introduce Dr. Anthony Pilny. Dr. Pilny is a graduate of the University of Florida's College of Veterinary Medicine. He had a residency in avian and exotic pet medicine and surgery at the Animal Medical Centers in New York, and he is a diplomat of the American Board of Veterinary Practitioners certified in avian medicine since 2005. Dr. Pilny has lectured nationally about avian and exotic pet medicine and has published numerous scientific articles and book chapters on birds and other exotic species. He also serves as an adjunct professor at LaGuardia Community College, where he teaches avian and exotic pet medicine to prospective veterinary technicians. Dr. Pilny is a member of the Association of Avian Veterinarians, Association of Exotic Mammal Veterinarians, Association of Reptile and Amphibian Veterinarians, and the American Veterinary Medical Association. Dr. Pilny also serves as the National Medical Director of the House Rabbit Society and shares his home with 14 pet birds, a cat, and a snake.
Thank you very much, Denise. I appreciate the introduction, and once again, thank you to Robin and Kelly for putting this together and inviting me to speak to all of you today. Welcome. We are very pleased and grateful that all of you took the time to spend with us this afternoon while we cover a really important topic. As we've already mentioned, this is part of a series that we've been working on to basically expand people's knowledge about the unfortunate aspect of unwanted pets. Pet relinquishment, pet surrender. We presented this series of lectures at an all-day seminar here in New York City a few months ago, and I'll begin this talk the same way I began that one, which was by starting and saying, I'm sorry that we're here, and unfortunately, this is a serious problem, and rather than harp on the fact that it is a serious problem, we all need to be focused on solutions, and I think that's what we're doing here today, is baby steps and working towards solutions to improve, build, and hopefully come up with some concepts to treat and deal with the growing problem of pet surrender and relinquishment, the formation of sanctuaries, the overcrowding of sanctuaries, and how we can better equip shelters on a small scale to be able to deal with birds. So I'm going to start this lecture by talking about the intake, and basically I'll follow through a series of discussions that involve everything from surrender of the bird all the way through leading up to the end of the talk, which would get us to the phase where we think about rehoming or placement of these birds, or getting them into sanctuaries or into permanent placement at that time. So initially, when we deal with the intake, we're looking at our ability to try to gather as much information as we can from the person that is no longer able to keep that bird. What is the main reason they're having to surrender that bird, and why they can't keep it any longer? Certainly, we deal with a lot of issues relating to behavior. We deal with a lot of issues that may relate to changes in family, changes in home environment. Many of us, of course, hear some of these excuses, and we sometimes feel sort of a low level of tolerance for some of the reasons why people will give up a pet. But we have to understand we're dealing with a situation where we have set it up that pets are, in fact, disposable, and if somebody chooses not to keep their pet, they're not going to keep it. They're going to get rid of it one way or another, so we need to be prepared to deal with that. Basically, when the owner brings a bird in, we can try to get as much information as we can. How long they've had that bird, how many homes it's had, where it's lived, where it was acquired. Any information we can get to put together a complete and thorough history is only going to help us in the long run. I do want to mention about leg bands as well. Many people that work with birds realize that pet birds or domestically bred birds are supposed to wear a closed leg band placed when they are babies at an appropriate age. The closed leg band indicates that it was bred in captivity or is a domestically bred bird. And in most cases, there should be a birth year. And that's the reason I mention that, because if somebody doesn't know the age of the bird, there's a good chance that if the leg band is appropriate, you'll find a birth year on there, and at least we can determine the age of that bird as well. Secondary, it would be nice if we could get any medical history. Do they have a veterinary record? Have they seen a veterinarian in the past? What types of medical issues have come up for that bird? And any other information they're willing to give us. Of course, we have to realize that we're dealing with situations where people have made the decision to not want to keep that pet. They may not want to give a lot of information. They may be concerned about what they say. They may be concerned about people getting too much information on them. And thus, they're looking to basically relinquish the pet and probably offer as little information as possible. But anything we can get for them certainly is going to serve us in the long run, especially if we can get veterinary medical records. It's also ideal when trying to do an intake to figure out as much further when we look in the individual specific care of a pet bird, where they lived, how many other birds lived with them, what type of diet they were used to eating, their general disposition, how friendly they are, how calm they are, how used they are to being around different people. We want to know what their comfort level may be with them being handled, with them being touched. Are they friendly? Are they known to be the type of bird that will go to other people, or are they the type of bird that's generally going to be nervous, timid, and very, very scared in new situations? A lot of times people hear about whether the bird has had a preference for a particular family member, and certainly, of course, any behavioral issues. This is going to be key to working this animal through and onto eventual placement, if placement even becomes possible. We're also dealing with a situation where birds may be surrendered without an owner attached. These are birds that are left in boxes or carriers. These are birds that are brought into shelters by somebody else, found in parking lots, you name it, any place that they may come in without the previous home or owner attached. In those cases, we're not going to be able to get a history. There's no way we're going to be able to get anything more other than what we can learn from seeing that pet at that moment. So we can evaluate some general observations, such as their temperament, how they visually look. Are there any obvious medical concerns or any obvious health issues that we can immediately detect? We can look for any physical problems, physical trauma. And then once we get that bird taken in, we can get them set up in a proper environment, offer them food and water, and then be able to observe anything further about them. So certainly it's more than ideal if the owner is willing to give us information on any medical history, on any background history, and everything that we would like to know about a surrendered pet, but we unfortunately don't always have that option, and we have to work with what we have. When we start to consider how to handle and transfer birds and work with them, the biggest part of this certainly comes down to the individual's willingness to work with birds. We are dealing with people who may not have a lot of bird experience. They may not have bird handling experience. They may not understand any aspects of bird body language, reading that bird, or anything about the individual bird's temperament. So we have to consider how we can work for both the safety of the bird and how we can work with the safety of everybody involved. As Denise already mentioned, these are prey animals. They do have a fight or flight type of reaction. They're scared, they're nervous, they've been displaced, they've been traveling, they're brought to a strange place with strange people, and they're very fearful, and their first instinct is to try to get away. Certainly we need to be sensitive to the fact that hopefully we've determined whether the bird is flighted or not, but if we haven't determined that yet, then we want to be careful that we don't risk that bird getting loose and escaping. Some birds may be outwardly friendly, may be willing to come right out of a carrier or a container. Other birds may be fearful and remain hidden in the back and not want to be touched. We have to look at these birds, leaving them in their carriers, and try to consider the safest way to approach moving that bird out of a carrier, getting that bird into a cage or some type of holding area, and be able to work with them in a very safe manner. And like I said, a big part of dealing with taking birds into the shelter situation is going to require willingness of the shelter people to want to work with birds. It only comes with time and practice. Some of these concepts are very difficult to teach. Some of these concepts have to be learned with sort of handling, with on-the-job training, and with a willingness to try to improve an individual's skills. Some basic guidelines, just to go through fairly quickly, we certainly never want to open the carrier in any open room that has high ceilings or has any place where a bird that could potentially escape from a carrier or from somebody's hands could fly up to a high place where it could be dangerous or inaccessible. Certainly no open windows, uncovered windows, any place where they could fly and then fall behind something. Paying attention to all of these factors is going to help prevent there being any additional stress or any additional problems. Certainly a quiet area, away from other animals, away from noise, any place that allows us to safely be able to manipulate that bird and be able to work with them in a safe way. Moving to a small room like an exam room, allowing the birds to have time to de-stress, this cannot be overemphasized. Most often, leaving the bird alone for a little while, letting them sit quietly in their carrier, giving them a moment to take in the surroundings. It works beautifully in my veterinary practice where I'm able to have the birds have a little bit of time to just relax and get to see the environment and know they're in a safe place rather than rush in, open the carrier, throw a towel over them, grab them, and act too aggressively. It's better to give them some time to just de-stress. Close doors, blinds, block any escape paths, and have all equipment ready. Certainly, if we had the option to have somebody who's confident handling birds, that's more ideal. Hopefully, if there are people who are bird savvy, they're able to train other members of the shelter and pass on the need for everyone to learn bird handling. One of the methods for transferring a bird when it comes in an appropriate type of carrier, be these what we call cat carriers or bird carriers or any type of enclosed box up to and including things like cardboard boxes or shoe boxes or any means of transporting a bird. And yes, we've seen them brought in bags, seen them brought in hat boxes, anything that people use that can contain them. Sometimes if we can actually put that entire carrier inside of a cage and then open the door or lift the lid, allowing the bird to climb out, find a perch, get itself comfortable, we can then have it in a safe place to observe it before even having to manipulate and handle that bird. That, of course, is if we don't see any reason to need to manually restrain the bird. We feel that the bird can be let loose in a cage, given a few minutes or some time to de-stress and adapt to the environment, and then be able to work with that bird at a later time is going to be more than ideal. This image here shows the handling for large birds. It shows a method for either having to put the entire carrier in a cage, or if it does not fit, having to reach into a carrier and be able to place a towel or some type of cloth or diaper pad or whatever works depending on the size of the bird over them in one quick motion to basically transfer them out of a carrier and transfer them into a cage. Certainly bird restraint is an art, especially people who haven't worked with birds before and are dealing with Moluccan cockatoo as the first one presented to the shelter. As we already mentioned, they want to be in a safe environment. We want to make sure we prevent any escape and prevent the bird from being able to fly or get away from us. Have equipment and supplies ready and within reach. Now, we are advocates of using towels or some type of material to hold birds. When we're talking about small birds like canaries, finches, passerines, and even budgies and cockatiels, certainly our bare hands generally work fine. At worst, it may be a tiny pinch, but then we can adequately restrain those birds. If we need more than just our hands, washcloths, dish towels, hand towels, even up to larger towels for macaws and the large species of birds work really well to assist us in being able to restrain them. It allows us to place these over the bird. It gives us more sort of square footage to cover, to hold in wings, to be able to hold onto the bird and restrain them safely so that nobody's getting hurt. Like I said, that includes the handler, other staff, and the bird. Capturing them in one quick motion, there's no way to teach somebody to not be afraid of a bird. It has to come with time and practice and handling. Everybody sees that huge beak. Everybody hears about the damage that they could do if they get a hold of a finger. So everybody's always initially fearful, combined with the fact that most people who haven't worked with birds think they're a lot more fragile than they really are. They're afraid to hold them too tightly, which often results in them letting the bird go or having the bird slip out of somebody's restraint. Or they don't have their hand held tightly enough around the bird's neck to hold the head, and then the bird can back its head up and potentially bite onto the handler or even other people who are working with the bird. As a veterinarian, it's absolutely vital in order to do anything to a bird, including physical exams, blood collection, any other type of diagnostic manual testing, to not have a bird restrained and properly held still. These are a couple images that basically show how to hold birds. Like I said, it really comes with time and practice. It comes with a willingness to learn, and it comes with a desire to improve on your skills. Small birds generally can be handled with bare hands, although some people do prefer even to use a paper towel or a napkin or a washcloth just to get that much more coverage around the animal. For medium and large-sized birds, wrapping a towel around them and restraining them basically around the neck, up against the jaw line, up against the underside of the beak, is really ideal. You will not choke a bird. Most people are fearful that if they hold too tightly around the neck, keep in mind their airway, their trachea, the windpipe, is freely movable in the neck, and it's very difficult to actually choke a bird while properly restraining them and holding the head still. The goal is hold the head still, hold the wings in to prevent flapping, and restrain the legs. This way it provides a comfortable restraint for the bird. They feel safely held. They don't try to struggle in most cases, and it allows the bird to be held for examination and or procedures. Time, practice, and a willingness to learn this is basically what it takes. Now, certainly, when restraining birds, the key point that we need to pay attention to, as one of our attendees just pointed out, is we absolutely have to make sure that we're not restricting the bird's body. You can see in this image, the bird restraint, there's a hand wrapped tightly around the bird's body. What we never want to do is prohibit the bird's ability to breathe, which is by expanding and contracting the entire sort of body cavity. Birds have fixed, non-inflatable lungs. Their lungs don't expand and contract like mammalian lungs. So basically they're reliant on having their body musculature and rib cage expand and contract. That way they force air through the lungs and into their air sacs as the means of the way birds will oxygenate and the way that they breathe. So the one big mistake that you can make is holding a bird too tightly and actually preventing that bird from being able to expand its body cavity, and that's the way that people talk about a bird suffocating. It's rare, it's uncommon, but when people are fearful and the bird is fearful and it's moving a lot, their impulse is to hold tighter. If you learn the proper technique, you learn you don't often need to hold this part of the bird's body anyway, but it comes with time and practice, and it's important just to remember this key fact that we don't prevent the bird's body from expanding and contracting, and we don't then block them from being able to breathe. Holding the head still, holding the wings in, holding the legs in a proper restraint, in most cases are not going to harm that bird or cause the bird any unnecessary or undue distress. So we've moved past the point where we've done the intake, we've taken the bird in, we've tried to collect a history from whoever surrendered it, and or we've observed this bird for a period of time now. The bird has been transferred out of a carrier unless it's being kept in the carrier for health and safety reasons, or it's out in a cage loose, and now we need to restrain that bird for a veterinarian or other shelter workers to examine them. And the reason I mention it that way is certainly the veterinarian at the shelter is ultimately responsible for the physical exam and the medical records involving the bird's medical care and physical exam results, but it doesn't mean anybody working in the shelter can't learn bird sign language, learn what a healthy bird is, and be able to look for problems. This should not be limited only to the veterinarian. Anybody working with these birds needs to be watching them. Signs of physical problems, signs of illness, anything that may not initially be noticed certainly can be noticed by anybody. And if the veterinarian is not available, anybody in the shelter that's capable and knowledgeable of birds can easily go through a general health checklist and look that bird over and make sure both eyes are open and bright and clear. There's no snotty nasal discharge. The bird is not having to breathe through its beak or showing signs of an increased respiratory rate. There's no blood. There are no cuts. There's nothing that physically can be seen with the naked eye that indicates any health problems. Once you spend more time with birds and you live with them and you understand them, you basically learn what's normal for birds. Sometimes people who aren't aware see a bird perching on one foot, which is a normal behavior in most cases, but they assume that means the foot that they're holding up might be injured, whereas that may be possible. That's something that also comes with time and practice. But the general health evaluation needs to be performed on all birds that are brought into the shelter, basically to make sure that any medical attention that's required is given, but also to keep a medical record of what is at intake. This certainly comes into play if the bird is being surrendered because it has a medical problem and owners are unable to provide veterinary care. And this is not an uncommon reason people surrender birds, and thus they're coming in with an injury or with a concurrent health problem that needs to be dealt with and needs to be recorded and identified as soon as possible. So the general health checklist, physical exam, vitally important when these birds come in. Hopefully, when people are working in shelters, they have the opportunity to take in a lot of healthy birds, and what we mean by that are birds that don't have physical or medical conditions that maybe are being surrendered for behavior problems, financial reasons, changes in someone's home life, and it gives the opportunity to really study birds and understand their body language and how to read them and how to work with them so that we recognize symptoms of illness quicker. Obviously, there are extremes. A sick bird won't hide their illness. We often talk about how these are prey animals. The instinct is to hide their illnesses as long as possible. There is, of course, a fine line, and there is a time where the illness is just stronger than the bird's ability to do that. What I often think happens in situations like that is birds may not outwardly manifest a medical problem until it's been going on for a longer period of time, or it's been going on for a longer period of time, then our diagnostic tests can reveal a diagnosis. So we want to make sure we don't miss any of those early signs of illnesses We want to make sure that we're very clear about what the outward visible signs of illnesses are in any bird. Denise also mentioned their higher body temperature. I use a number of about 105 degrees. We don't take birds' temperatures. There isn't a really great way to get their true core body temperature, but we should assume that it's somewhere around 105. And that comes into play in a lot of situations where birds may need to stay warm or be kept warmer. It also has to do with their metabolic rate. Keep in mind, birds have a very, very high metabolism. Most species of birds need to eat a certain amount of calories a day almost to be able to wake up the next morning. These birds need to take in a lot of nutrients. They need to go through the processes to maintain that metabolic rate. And we often talk about, a day in the life of a sick bird can be many, many days in other sick animals. A dog or cat can go for a lot longer than a bird. Dehydration, starvation, dramatic muscle wasting, and weight loss happen very quickly in birds. And sometimes we only have hours to days to work with a bird as opposed to any type of buffer in working with them. And these come as people work more and more with birds and start recognizing all of the key tenets of what defines a sick bird. Historically, in the early days of avian medicine, the poop was, of course, the biggest factor in the bird's health and well-being. When people started keeping pet birds, people were limited to what the droppings looked like, and thus we looked at those droppings as if they were an indicator of the entire bird's health. And we now know that's not true. We know that avian medicine, although still not as advanced as other areas of veterinary medicine, does allow us the ability to run blood tests and viral screening and advanced diagnostic tests and x-rays and ultrasounds and CAT scans, and we can do all of these things. And so the value that we place on the droppings centers around conditions that relate to what would show up in the poop, as well as conditions that maybe relate to intestinal disorders. But it's the first thing that we can look at when we see a bird. Keep in mind, birds that are stressed and anxious may urinate more. There may be liquidy or wetter droppings. They may have a transient stress type of diarrhea, and the droppings that initially they leave may not be representative of what they're doing otherwise. But it's important that we pay attention to them to see what they can reveal. I'm always concerned about droppings that are very dark green to black, almost looking like they're melanic. That often indicates the bird has not been eating or not been getting enough to eat for a period of time, so we need to pay attention to how that appearance is. It's also important to understand what the normal dropping should look like. At the same time, in the cloaca, the intestinal tract will drop the feces, the urinary tract will bring the urine, and these are mixed together with the urates. The urates are the byproduct of protein degradation. All of these are mixed together and passed out of the bird's body at the same time. So yes, birds do urinate. Obviously, we can discern whether there's an excessive amount of urine versus diarrhea where the poop is not formed at all. We certainly have to be sensitive to blood in the droppings, dark droppings, undigested food that appears in the droppings. Any other clues that we can notice may be important in this bird's intake. Like I said, we certainly don't want to overemphasize what the droppings are telling us, and we can no longer actually be able to use the poop as an overall indicator of the bird's health. We can take these things further, leaving this as a function of what we're doing in the short term in the shelter. We're going to be looking at these birds and caring for them and learning as much as we can. So definitely the poop is something birds are good at giving us, and it's something that we need to pay attention to. So we'll switch gears a little bit and deal with those situations where birds are either brought into the shelter in an emergency type of condition, or these conditions develop once the bird is in the shelter. And for the next few slides, we've gone through and done some re-editing so that we could separate the concepts of what are emergencies versus what are urgent versus what can technically wait for veterinary attention. And I think this becomes, again, a matter of recognition, a matter of early diagnosis, and of careful observation of the birds under an individual's care. Any birds that experience the listed symptoms here will most likely need veterinary attention as soon as possible. Birds that are showing any type of respiratory distress, the inability to breathe well, anything that looks like they're having trouble breathing, they need medical attention quickly. Respiratory conditions are very complicated because we have to remember that birds can show respiratory symptoms for primary respiratory diseases, but also secondary and tertiary problems. The growth of a tumor can cause them to look like they're having trouble breathing. Fluid that builds up can look like they're having trouble breathing. There's a number of manifestations where respiratory disease may not be a primary respiratory condition, and we hate to miss those. Bleeding, broken feathers, active bleeding, blood all over a bird, anything like that requires immediate attention to determine the severity of the source of the bleeding. Certainly birds that have what we call blood feathers, those newly growing, newly formed feathers, may break those in transit. They may break those on their way to the shelter, or they may break them in a shelter setting, and we have to make sure we can recognize it's a feather versus bleeding from somewhere else, so that hopefully the bird can get attention and we can remove the bleeding shaft as quickly as possible and resolve that problem. Seizures, any physical signs of injuries, any open wounds, birds that are unable to use a leg, use a foot, use a wing, keeping an eye closed, etc., anything that indicates there's a condition needs to get moved to determining whether we're dealing with an emergent condition or we're dealing with an urgent condition. And like I said, urgent conditions mean they may not need immediate care, but they will need care as soon as possible. Certainly, it's very important to remember that there may be injuries underneath feathers, as one of our attendees has pointed out. There may be injuries that we have to look under wings, look in certain areas of the body. We actually have to sometimes look through the feathers to try to find bite wounds, to try to find any traumatic injuries, and it's important that we not neglect doing that during our exam. When we're looking at urgent conditions, and certainly we can't go over every medical condition, what we're trying to do in the scope of this lecture is really target those conditions that are more specific to pet birds. Birds that are limping, they can't perch or stand, they're at the bottom of the cage, unwilling to climb up the cage or get to a perch, any discharges but don't appear to be affecting breathing, what we think of as our typical ain't doing right ADR bird, lethargic, fluffed up, little depressed, but they don't seem like they're in immediate need of any medical care. Certainly birds that are vomiting, gagging, regurgitating, throwing up, anything like that is going to require medical attention, but the bird may appear to be stable otherwise. And as we mentioned in a previous slide, certainly any obvious changes in the droppings need to send up a flag to determine whether this bird is urgent or whether we think this bird needs emergency medical intervention as soon as possible. One of the things we're certainly sensitive to here in New York City are concerns with heavy metal toxicity, which happens all over the world, but we see more of it because of our old buildings and our birds' access to so many old pre-war homes that people live in. We're going to want to be keyed into the fact that some of those birds may have blood in their droppings, and sometimes that's the only clue. So we're looking at a determining factor of how quickly we need to get medical care for these birds. Some images of what we think of maybe emergency versus urgent conditions. Any birds that come in with severe trauma, severe injuries, attacks from predators. This is, of course, a big one. I was taught many, many years ago in veterinary school, if a bird lands in the mouth of a predator, even if you don't find puncture marks and bite wounds, you have to take that seriously. There is the potential for septic shock to occur very, very quickly. And if there's any potential there's an attack from a predator, we want to be in tune to that. Leg weakness or paresis from heavy metal poisoning we were talking about, and certainly any injuries to these birds that could be caused by other birds. Oftentimes people keep birds together that may or may not get along. They may be housed in community situations. That bird may be winding up at the shelter because somebody has them living together and they've determined that bird is causing unrest living in a community situation, and that may have resulted in injuries. Certainly there are certain species of pet birds that when kept in opposite sex pairs, even with the intent for breeding, are known to potentially be very aggressive toward each other and potentially deadly. Some of these are the cockatoos that may physically assault and hurt their mates, and we need to be able to pay attention to these type of problems as well when these birds come in. Egg binding is a serious consideration. Oftentimes these birds are presenting in one of two ways. They're either stable or they're in shock and need immediate care and attention. There's probably not going to be an opportunity to take an x-ray in a shelter situation. Oftentimes we can palpate if there's an egg low enough in the coelomic cavity. Once you've felt it a few times, generally you get pretty good about doing a palpation of the lower abdominal cavity and feeling if there's an egg that's low enough to be felt, to at least let us know that that bird is in the process. Keep in mind, because an egg is there doesn't mean the bird is necessarily egg-bound, and it certainly doesn't mean that the bird needs immediate medical attention. Problems with tumors, problems with growth, problems with obvious skin masses, like you can see here in these particular birds. These tumors may be cancerous. They've probably been there for quite some time. The birds are probably going to need medical attention, and they're going to need to be looked at, but it may not be immediate or urgent medical care. There's another x-ray you see there as well that shows a bird that has metal particles in their stomach, in their gizzard, and this is a bird that may be suspect for heavy metal toxicity. Of course, we don't know yet if that metal is a toxic metal, but we certainly know this is a bird that has been allowed to eat things it shouldn't, and that's often a clue. And like I said, when the shelter takes a bird in, has an outreach with a veterinarian, these are all the things we're going to be learning about these birds, especially if the medical care involves taking these birds to an access veterinarian working with the shelter and then returning the birds to the shelter with hopefully a diagnosis. I do want to mention here as well in seeing some of these images that we do have to pay attention to the possibility of some of these medical conditions greatly affecting what's going to happen to this bird in the long term. Those of us that deal a lot with rescue, that deal a lot with sanctuaries, and that deal a lot with surrendered pets are always faced with those ethical and moral issues about the possibility of placement and those animals that are going to be either difficult or nearly impossible to place. Birds that have terminal conditions, birds that come in that are extremely ill, or birds that may need to eventually be readopted to somebody with a chronic long-term medical condition always present a difficult problem, and those issues need to be addressed as well in dealing with these birds. So hopefully when we look at these birds, we can determine, even in the shelter situation, if we're dealing with an acute onset problem or are we dealing with something that's been going on for quite some time. Chronic infections, chronic respiratory disease, old injuries, old trauma that has already healed, anything that may have been present for quite some time, we would consider, okay, under our avian conditions, but may not require emergency care. Now we move into just some of the common conditions that we see. These include traumatic injuries. These include broken bones that may or may not have healed properly, burns, physical trauma, birds that have flown into walls or mirrors, birds that have been bitten and not received medical attention. The image you see here is our classic budgerigar with the skin mite, easily recognizable once we've seen it. These birds will come into the shelter. They need to be treated. A simple treatment to get rid of those ectoparasites works really well. Fairly common condition. We could probably spend 35 hours going through all the common medical conditions of each species, but we don't have that time, maybe at a future date. Basically, we're looking at common conditions these birds come in for. Denise had alluded to a couple of these earlier. Toxic exposure in birds. Teflon, overheated, will emit a toxic substance that is toxic to anyone breathing it, including us. Birds that have had any type of substance stuck to their feathers, anything on their feathers and skin, anything they've been exposed to, or anything that they've been in an environment with, we have to pay close attention to the risks of toxic exposure. When we talk about the shelter setting, bleach and bleach fumes, if they are not properly diluted and or used around birds in a closed setting, may be very, very dangerous. There was a study that was performed many years ago that showed that bleach is a respiratory toxin to birds. A lot of shelters may be using bleach. We just have to pay attention and be sensitive to those fumes around birds. In some of our older birds, we certainly do see arthritis. Arthritis can develop in some of the more long-lived birds. It can present itself in the inability to constrict the toes on a perch, the inability to move certain joints. I've seen birds that have arthritis feather picking over the joints or over the areas where they have the arthritis. So certainly that's a condition we see in some older birds. Reproductive conditions. Remember, these birds are not spayed and neutered. They are not routinely spayed and neutered. I'm not sure that we're going to see it reach that point in our lifetimes. I think that would be an amazing thing if we're going to continue to keep birds, that we figure out a way to come up with a system of being able to spay and neuter these captive pets. And I say that only because it would probably prevent 90% of the birds that are going to land in sanctuaries and shelters and be rehomed for all those issues related to the fact that these are intact animals with hormonal urges. They reach a certain age, they reach puberty, and they're very, very programmed to want to find a mate, build a nest, lay some eggs, and raise a family, and then repeat this process over and over. We often don't allow that to happen for whatever reason, and this often leads to more serious problems, many of which result in relinquishment of that bird. So reproductive tract diseases, very common in veterinary practice, issues relating to egg binding, prolapsed tissues, disease of the reproductive tract, tumors and cancers of the reproductive tract, any of these type of problems, certainly we need to be sensitive to in birds. Neurologic conditions, seizures, and any of these type of disorders, there's a wide range of causes for a lot of them. Toxin exposure, including heavy metals, chronic conditions, organ failure, any of these type of problems certainly can present themselves as a neurologic condition, and we see a whole variety of these type of medical problems. Problems relating to dehydration and starvation are certainly very concerning. We talked about the bird's metabolic rate being very high, the need to have access to food all the time and to stay well hydrated. Any bird that is sick, any bird that has not been eating or drinking normally, should be assumed to be some degree or some percentage dehydrated and to be undertaking the amount of calories they require. So we want to make sure that we can direct attention towards fluid replacement and feeding, etc., when possible. Certainly swellings, tumors, growth, fluid accumulation, this is something that needs to happen during the physical exam. Part of the physical is palpating the bird's body, feeling the lower area of the coelomic cavity, looking for fluid buildup, looking for growths or tumors or masses, trying to determine as much as we can, and then working backwards, looking through some of these common conditions. And like I said, we can't go over an entire course in avian health and medicine and avian surgery. There's a lot of more common, more specific conditions that relate to the bird's anatomy and physiology, that relate to previous and captive care, that are all issues that we need to be sensitive to. And I've said it 1,000 times, but come with practice, knowledge, a willingness to learn, and a desire to understand birds and be around them. It's important to remember as well that birds are not unlike many other pets in the potential that they can harbor zoonotic diseases, diseases that they can transmit to people. Let's not also forget there are diseases that people carry that they can transmit to birds, so it's important to remember those type of diseases as well. When we look at pet birds, especially wild birds, especially when pigeons and doves and these birds that have been outdoors are brought into sanctuaries and shelters, as well as domestic poultry and other fowl, these birds can harbor zoonotic diseases and be completely asymptomatic. These conditions may be chronic, they may be long-term, and it's important that we consider how we can keep birds separated from other species of birds. We'll touch a little bit on quarantine as I end my talk, but we have to consider about not spreading these diseases, and we have to make sure anybody handling and working with birds is, of course, sensitive to the potential for birds to harbor zoonotic diseases. There are a few listed here on this slide, certainly fungal diseases, the bacteria that causes mycobacteria, salmonella, We'll talk a little bit specifically about psittacosis, and then some parasitic diseases, all of which are considered to be transmissible to humans. It's important to remember that an immunocompetent, healthy individual is unlikely to contract these when they're working safely with birds, and there aren't often young children or elderly working in the shelter situation in a condition where they should be exposed to potentially sick birds anyway. So a little bit specifically about chlamydiosis or psittacosis or Chlamydia psittaci, the bacteria that causes the disease psittacosis. And probably because it tends to be a hot topic, it's an important medical condition in birds. It is a reportable disease. Any confirmed cases need to be reported to the proper health authorities in some states of the United States. Psittacosis was first discovered during the old days when birds were only illegally imported and caught in the wild. They would be brought into America, birds would die, and then they discovered the cause in a lot of these birds being related to this particular bacteria. It does still remain present, although the actual prevalence seems to have gone down with advances in diagnostic testing, our ability to get an earlier diagnosis, our breeders and our sanctuaries and our zoos being sensitive to the potential for this disease to exist. We've actually, I think, made strides in not seeing nearly as much as was presented many, many years ago. It's important to remember it is a zoonotic disease. It will cause flu-like symptoms in humans. It's transmitted by direct contamination, inhalation, cleaning up droppings. Birds can harbor and can spread the disease without showing specific clinical signs. Obviously, when we're working with any new bird that we suspect may have any type of medical illness, certainly we need to make sure that we practice good hygiene, common sense, protective clothing, if necessary, a face mask, gloves, eye shields, anything that may protect an individual until we have a better understanding of that bird's status, keeping in mind what's sensible, keeping in mind what's not considered to be overkill, and making sure that we're just sensitive to the fact that birds can harbor these conditions. Certainly, if we can isolate these birds, like I said, I'll talk a bit more about quarantine shortly. We can treat these birds, and they can be treated for it with approved doxycycline antibiotics, and then certainly limiting exposure and being able to properly clean up these birds should they be infected. And as I mentioned, there are certain diseases that humans can pass to birds. Humans can be carriers and transmit to birds. One of the big ones now is our MRSA infections, our methicillin-resistant staph infections. We now know that birds can be carriers and give those to people, and we also know that people can transmit those to birds. All of the zoonotic diseases are considered potentially to be carried by either people or birds and may be transmittable to each other. Fortunately, other than some of the more commonly known ones that have been discussed, there aren't a lot of diseases that humans carry that we're going to give to these birds other than the common ones we've talked about and considerations about MRSA. Most of the bird viruses are not transmittable to people, and a lot of our viruses, for instance, the flu viruses that we have, are not thought to be infectious to birds as well. Common sense, good hygiene is what we need to think about practicing. A little bit about fluffed feathers and the concept of what we're seeing there. A real nonspecific, sort of vague clinical sign. Basically, fluff feathers tell us something is wrong as long as we're able to recognize that these are fluff feathers for a medical illness. It's an outward indication the bird just feels sick. They're not well. They're lifting their feathers to get more heat to their skin. It needs to be evaluated in the context of their immediate environment. Some birds that are nervous, scared, angry, or stressed may have their feathers a little bit ruffled. If they're in a cold area, they may lift their feathers a little bit. If they're anxious, if they're upset, if it's part of their grooming, they may have their feathers ruffled a little bit. But there may be other indications that we know the bird is sick. They're staying at the bottom of the cage and fluffed up. They're having trouble breathing. They won't perch. They won't eat. They look obviously ill with nothing more specific than that they're quiet, depressed, and they've got all those feathers fluffed up. fluffed feathers or puffed feathers or any of these terms are often something that people key into immediately. The bird's been fluffed for 2 days. Whether they see other clinical signs or not, it is an important thing to recognize. It's probably not something that we need to sort of sound the alarm. The bird is fluffed, it means it's going to be dead soon, but we do need to pay attention to it as an important clinical sign. And certainly we see here in birds that are healthy, birds that are out, excited, engaged, preening, nesting, sleeping, they may have their feathers slightly fluffed a little bit, but that bird in the bottom corner certainly is fluffed, but in a really bad way. So we're able to recognize the difference. These other birds are alert, they're aware, they're looking around, they're perched. Their feathers are slightly fluffed, but it's probably not an indication there's anything majorly wrong. So when we look at supportive care for these sick birds, what can we provide in the shelter? What can we do when these birds come in? What do we need to do in the immediate short term? How do we stabilize them? Where can they be held or kept? How soon until we can get veterinary attention? How soon until we can do more than provide basic supportive care? Well, sometimes basic supportive care is all these birds need, and sometimes that's enough to treat and get them back to a better place where we dramatically increase their survival. The ability to get them in a quiet, warm environment, to provide food and water, to set up a hospital cage if necessary. Birds don't have to perch. They don't need to climb up to an area. They can stay on the floor. They could stay on the bottom of a carrier. It's not going to harm them to do that as long as they're in a safe environment. Providing enough access to food and water, making sure that the bird has an opportunity to de-stress, warm up, sleep, rest. Not rushing into doing too much too quickly is really important supportive care for these birds while we assess the true extent of injury and true extent of illness in them. This just indicates one example of a hospital enclosure. Any type of carrier, any type of plastic bin, any type of enclosure is often ideal for these birds. They're sick, they're depressed, they don't need to fly, they don't need to have a large space to move around in. They just need to be kept in a warm, humid environment where they can have access to food and water and be kept clean and safe. This type of example is using a easily disinfected plastic bin that people might use for storage or for clothing. Pet carriers, cat carriers, any of these type of devices may work in the short term to house a sick bird. And that's really important that we have what we need equipped for them. One of the key things to remember is when birds do get spooked, they do try to take flight. We want to be careful that we have access to the bird. Sometimes when we have a large door, it's nice to cut a small door in the center of it that allows somebody to reach their arm through but blocks the ability to open an entire door where a bird may be able to come out. When we're talking about disinfectant agents, certainly there are a number of different appropriate ones that are available. A couple that come to mind, people will use Rocal very commonly in veterinary practices and animal situations. There are a couple other brands of approved antibacterial, virucidal, antifungal type of cleaning agents. A 1 to 10 dilution of bleach is often ideal. It's still disinfecting, but it still is generally safe when not used directly around birds. There are a number of other approved disinfectant cleaners that, when diluted properly and used topically, are very effective at controlling diseases, and that information can be provided in a follow-up later date. So certainly some of the common conditions when these birds come in that are not considered to be severe or medically necessary to get immediate care, or that are something that has been going on for some time in this bird that is just part of who that bird is, we consider those. We're certainly going to be looking at the two big ones, which are feather-destructive behaviors and self-mutilation behaviors. There's a good chance that these are not new. Oftentimes these may have been going on for months to years to many, many, many years. They're complex behavior problems. They're going to require a lot of time and patience in dealing with them. There is never a quick fix for them. Recognizing those birds that come in that look like any of these pictures where they have purposely removed all their feathers, where they've crossed the line and mutilated their skin and torn their skin open. Situations where a bird is plucked in places where the bird could never reach means somebody else was pulling the feathers out. Certainly birds that live in mate pairs, one may be plucking the feathers of the other bird. They're complicated conditions. They're very difficult to deal with. In some cases, they relate to a medical condition that could require a lot of testing or a lot of treatment. In other cases, they relate to behavioral, hormonal, social imbalances, boredom, any number of different issues that may cause a bird to develop these behaviors, and they become chronic long-term conditions. Certainly people that own these birds or have lived with them often come to accept the behavior. If we can ascertain the bird is healthy in all other ways, then certainly we can deal with one potential behavior problem that we can probably work with and something that we can probably help get this bird through. Sometimes getting them into a better environment, sometimes getting them into a different home certainly may be really important. I see there's a question that somebody posted about options on wing trimming for flight control in shelters. There's the potential for this to open up an enormous debate about wing trimming. What I certainly would like to say is that will be in an upcoming webinar. There'll be a lot of discussion about that. A few quick points. One of those certainly is that I personally and many of us are not advocates of birds being deflighted or having their wings trimmed unless it's medically necessary or necessary for the safety of that bird. If a bird comes into a shelter, if it's deemed necessary, a one-time wing trimming to deflight that bird for that bird and everybody else's safety. Remember, it's not a permanent procedure. The bird will shed those cut feathers and grow in new feathers. If deflighting that bird is vitally important to the bird's health, the bird's safety, people's safety, training the bird, working with that bird and getting it into a home, then certainly it's the appropriate thing to do while encouraging them to reach a point to allow that bird to be able to return to flight. First and foremost, I would advocate for allowing birds to fly, but I would also advocate when it's a safety issue or a serious issue, those birds' wings may need to be trimmed. Some shelters may decide it's their personal policy. Birds come in and are deflighted for all the reasons we've talked about, with the understanding that it's just a better arrangement for that shelter, then by all means they should be taught how to properly do it so only the right feathers are cut, and that we do it in a safe way that allows everybody to work with that bird. Certainly, the ability to take in a bird that already has a wing trim is something to recognize and notice and understand that we don't know what stage that bird may be in of shedding those feathers, and we don't want to ignore the fact that they may come into a shelter and regain their ability to fly that they didn't have when they came in a matter of weeks. Some other common conditions that we see outside of feather destructive, but we recognize that they've been there for a long time, certainly relate to deformities, overgrown beaks, poorly healed injuries, poorly healed fractures. Any of those type of things are going to be recognizable as a chronic condition. They may or may not even have medical remedies for those. They may not even be able to be fixable or treatable. A lot of these may be chronic conditions that the bird has suffered with an inappropriate diet, a chronic debilitating medical condition, chronic infections, chronic viral disease, etc., and those need to be pointed out and recognized as well. And lastly, with some of the common conditions, certainly ungroomed birds, overgrown toenails, chewed up feet from being in cages and landing on other cages, feet and limbs that have been previously amputated either on purpose or accident, any of those type of things. Certainly we know that they're a chronic condition. They don't require any immediate medical care, but they're something that we need to know in working with being able to work with that bird. And then shifting gears a little bit just to the concepts of quarantine. And certainly quarantine is a very, very important aspect of working in a shelter situation. It is also very difficult. It is also very challenging. There are a lot of facilities and a lot of shelters that barely have room for the animals that they take in. If they're going to now add another species of animals that they're taking in, the ability to then ask for a separate quarantine area becomes very challenging. Once again, this is up to the individuals in the shelter and how they work through this. Our goal here is just to put out the concepts, plant the seeds, have the ideas out there so that people are sensitive to the concepts of what these are, so they could at least think through some of this as they work towards preventing disease transmission. Certainly some of the shelters are not going to be able to isolate birds. Some of the shelters will not have the means to have a separate area. So what I have here in the last part of this discussion really relates most specifically to the ability to practice quarantine in sort of the more perfect way. Quarantine generally is from the Latin term that means a period of 40 days. It's basically an enforced isolation to prevent the spread of disease. Any bird that comes into a shelter may be harboring an infectious disease. These diseases can be spread to other birds, they can be spread to individuals, or individuals may accidentally spread these. So in the ideal situation, birds would be put in a quarantine area where they would be observed for a period of time to determine that they're free of signs of infectious or contagious disease before they're ever put in a population or exposed to other birds. It's ideal if all birds do that. Certainly birds that are cleared from quarantine, if they become re-exposed, we need to be sensitive to the fact that they've now been exposed, and that may negate any quarantine procedures. Once again, I reiterate, this is an ideal world type of situation. A separate building, a completely separate room, a completely separate area with a separate airspace is the most ideal. It should have a separate entrance. It should not be an area where people have to walk through to get to other areas. It should not be a main hallway, near a kitchen, near food storage, anything like that in an ideal situation. Disinfectant, disposable gowns, foot baths, they've become a bit controversial lately. They're listed in the slide. They may or may not actually work. They may actually promote spread of disease. That's another whole topic. But any methods of disease transmission prevention need to be paid attention to. One of the big ones certainly is not sharing. Trying to designate certain bowls, certain perches, certain toys, anything within a cage with a specific bird should ideally be left with that bird. We don't want to take that bird's bowls out, fill them with food, and then put them in somebody else's cage. So paying attention to trying to do that is more than ideal. Removing them separately, working with them first, certainly working with and servicing quarantine birds after the healthy birds and after the birds that have been deemed out of quarantine is a really important concept as well. Taking care of those birds, using appropriate disinfectants, and then moving into the quarantine area or areas and then working with those birds. In an ideal system, any new bird added to a quarantine area restarts the entire quarantine, keeping in mind through everything we're talking about in these lectures, in these series of webinars, they're planting seeds and they're basic concepts. Every shelter is going to have a lot of limitations. A lot of the shelters are going to do the best they can. We know that everyone does that. They're going to have limitations and they're going to do what they can. They're going to be aware and understand these concepts, pay attention to them, and be able to follow through with what works in that individual shelter. Certainly any birds that are in quarantine need to be monitored. We need to pay attention to them. Look for signs of illness. Look for changes in droppings. Look for loss of appetite. Anything that may indicate that that bird is now showing signs of illness should elevate our needs to pay closer attention to that bird and also may extend our quarantine basically so that we don't introduce that bird to other populations of birds. Changes in any specific behavior, changes in anything that are noticed need to be taken as a potentially serious indication when a bird is in a process of being cleared for quarantine. Quarantine is equally important in pets. This is a concept that people don't realize. They have a pet bird, they go to the pet store, they acquire another one, bring it home and put it in the cage immediately. Even if it's kept in a separate cage or a separate room or the other side of the room, so that there's this period of time when the bird comes in the shelter that somebody is able to keep that bird separate, keep it for observation, and look for that bird to then manifest any signs of disease is an ideal situation. Ideally, comfortable room temperature is usually fine for healthy birds. Birds that are kept indoors do well with our room temperatures. Adult birds can tolerate cooler temperatures. They prefer it warm. They don't like it too hot. Mostly what we consider our comfortable home temperatures and then up are ideal with birds. Mid to upper 70s, low 80s. Of course, that depends on the native origin of the particular bird and the ability of what we can provide. But ideally, most of our home temperatures are suitable for these birds in a shelter situation, offering more heat when we need it in colder temperatures. When we're dealing with quarantine in a veterinary clinic or in a hospital, certainly we have a better means. We have hopefully a whole isolation ward. We have a cage set up like some of those that are seen here, where the birds can be kept in individual isolated plastic front doors that have seals that are easy to disinfect. They don't have edges. They don't have crevices. There's a means to nebulize, to humidify, to provide oxygen. You can see these cage doors have the openings for hands to reach through, but you don't have to open the entire door. This is a means to have a quarantine so these birds can be safely kept by themselves, still visually observed, and still maintained in a proper quarantine area. If the shelter is capable of having a separate room, it's ideal to have a setup that's something like this. Now, when we have a situation where an owner that's had a bird for a long period of time, that has kept that as the only bird, that then tells us the bird has not been exposed to other birds, has not been boarded, has not been in a veterinary hospital recently, has not been in a shelter, or had any type of other exposure, that becomes an individual assessment with a quarantine period. Certainly birds that come in with proof of diagnostic testing, they've been tested for psittacosis and certain viruses and other diseases, if they can provide that paperwork and we know that bird has been tested without exposure, that can certainly shorten or invalidate a quarantine period if necessary. If the owner can swear that the bird has not had exposure, a home quarantine certainly may count in these situations. Once again, an individual decision on those taking the bird in. It comes down to individual policies about what that shelter does to handle birds and whether they want to have a policy that says all birds need to be isolated for observation or pick and choose and determine accordingly which is the best way to work through that. Basically, quarantine requires us to follow the rules. Try to pay attention to the length of time that the bird is in there. Keep birds in quarantine, observe them. The main goal here is make sure that any new birds are healthy before they are put into population or before there's exposure to other birds, before other birds are exposed to them. The disclaimer here, of course, quarantine is time-consuming. It does create more work. It may be somewhat inconvenient for individuals, but it also may save many lives and may prevent other birds from becoming ill. This is a really important concept. It's something that we deal with in pets. It's something we deal with in individuals who want to rescue birds, and it's also something we deal with in the shelter situation. And it's really, really important that we pay attention to these basic concepts. So that's kind of an overall sort of fast summary of the intake and dealing with birds in a shelter situation. The key concepts before our final word, and we get to some questions. Shelters can learn to take these birds in, learn how to care for them. Individuals that have a particular interest ideally should be sought out and placed in positions where they work more with the birds. We're in a situation where we're having to deal with what people have called a tragedy. The sheer numbers of unwanted pets, specifically to us, the unwanted birds. It's devastating. It really is a tragedy, and it's something that we need to deal with. We're taking some steps here. We're having to work towards a better situation for these birds. We're having to work towards a means to get these birds into better care. Shelters and sanctuaries and individuals can do this. There's a lot more on the handbook. There's a lot more online. There's a lot more from the Global Federation, from the Avian Welfare Coalition. A valuable wealth of information is out there to help anybody. We're here to help anybody to reach out to as well. But the main thing is take these birds in, provide the basic care, provide medical care, and work with getting these birds rehomed, readopted, and into the right type of environment. The final word, as you can read here on this, we certainly can never do justice to birds in captivity in a lot of ways. But we can do the best we can like we do with all of the pets we choose to keep. We must see to it that birds get the right type of care, the right type of food, and get to act out on their natural behaviors. We have an ethical responsibility to these birds. We have a responsibility to the fact that birds are becoming one of the most rehomed pets. People say sometimes in as short as 2 to 3 years that people will rehome them. We have an ethical responsibility. We're all doing our part, and I think that we all need to continue to do that and work towards a better world for these birds. So we can go through a few questions at this point. I think we have a little bit of time, and then we can answer some that haven't been addressed through the talk, and as was mentioned in the beginning, any others we will get through at a later date.
Thank you so much, Dr. Pilny. I just want to jump in really quickly and thank everybody for attending, because if there's anybody that needs to leave before we do the Q&A, I just want to make sure. Thank you all so much. A huge thank you to our presenters. It was a great presentation. The slides, I just want to address a couple things in case anybody drops off. The slides are not available, but we will have a recording of this session. And so if you watch your email in the next couple days, we will send a follow-up email which will contain a survey. Again, it will contain the link to a lot of the documents that Dr. Pilny and Denise mentioned today. And it will include information about how you can view the recording and how you can have others view the recording, because you can definitely, if you have other members of your team that you think would benefit from it, they can definitely take a look at it also. So again, if you need to drop off, again, thank you so much for attending. Watch again in the next couple of days for another email, which will also have information about the second presentation, the second webinar in this series. So, as you mentioned, Dr. Pilny, there were several questions. I don't know if you want me to read some off to you that I've kind of been saving that may be up in the chat already. Do you want me to go ahead
I actually see one that, if I can start with one that I'd like to address, because it's a great point. It's the question about leg bands and about the need to sometimes remove them and the potential that sometimes a wrong size leg band comes in with a bird, etc. So the question, I think everybody can see in the chat, is there a legal requirement for birds to wear leg bands? No. It's ideal for them to have them as a form of identification. If an appropriate size leg band is placed on the bird at the appropriate age, the majority of birds can wear those their entire lives and have a permanent form of identification that's safe and unaffects them. Certainly, there are medical reasons why leg bands have to be removed. There are problems where issues come up. Say a bird breaks their leg and needs to have a splint or surgery, we may need to take it off. But there are situations where they need to come off. You cannot replace an appropriate size one on an adult bird. So once they're cut off, if a leg band is put back on that bird, it's going to be a size large, and that in itself sets up for a greater potential for injury. The flip side of this, certainly, are microchips. Let's not forget we can microchip most of these birds. As recent as, I think, about 2 years ago, there is a new company that is marketing microchips that are significantly smaller than the past, and they have a much smaller needle, and we can place them in much, much smaller birds. So we do have access to microchips as a permanent form of identification. Let's also not forget, key point, that birds being brought in the shelter should be scanned, just like all stray animals that come into any shelter. They need to be scanned because I do place microchips in birds quite often, and we'd hate to think that there's a situation where we miss a microchip. We know that certainly does occasionally happen in other animals, but let's remember microchip placement is an option in birds and does offer a permanent identification and maybe something a shelter, if they're funded enough, wants to do with all their birds.
Thank you very much. Did you see any other questions that you wanted to address in the chat, or did you want me to pass any along to you? Or?
If you have a specific one for Denise or I, then you can point it out as well.
Actually, I would like to just mention that there was something that did come in about, the inability of shelters or that they may not be prepared to provide some of the medical care for birds, but that's exactly why we're doing this webinar series, is to open and establish some dialogue between shelters and some avian people who will be able to give them some guidance in these areas. I think it's really important. I do know that there are several shelters around the country that are already taking in birds have established an avian program, and they're doing a terrific job. And so it can be done, as Dr. Pilny says. It's just a matter of reaching out and getting the connections made and the networking that enables this to happen. So, yes, I give animal shelters who are dealing with the dogs and cats every day and having to take those animals into the kill room. Believe me, it's a gut-wrenching job, and anything we can do to make their job easier when they get a bird tossed on their doorstep that they're not totally prepared to take in, but that may be that bird's only salvation in that instance. So we have to provide the resources so that they can help them.
And to build on that, I work with a lot of shelters and rescue organizations on large and small scale. I'm not employed by them. I don't make money from them. I'm available sometimes on a consultation basis. Sometimes it's just email. Sometimes they require my services in specific cases. So if a shelter starts working with birds, they need to reach out to veterinarians that are willing to devote a little bit of time to help support them through it. And we work with our local shelters. When birds do come in, we do ask that they do reach out to us and use us as a resource, even if it's for, like I said, phone consultation, email consultation, having somebody bring a bird to our hospital for a cursory exam by somebody more experienced if they feel like it's something beyond their ability, partnering with avian veterinarians or veterinarians that can offer help and services. They're usually out there, and that's usually an important thing for these shelters to work on doing. That medical care is not usually available in the shelter, but it is something that's available, and people should be prepared to seek that out.
I also wanted to mention on part 2 some of the questions that are coming in on environmental enrichment, managing stress, things like that. That will be part of number 2, which will be focused a bit more on the nutrition aspects, the housing aspects, and managing stress and enrichment. So those will be covered in part 2, and as Kelly said, she will be sending out information on that in a few days.
And thank everybody so much for attending once again. Like I said, we're going to have to sign off. If there are other questions, we will happily answer those, and those can be distributed. But we really, really appreciate your attendance, and I can't encourage anybody enough. If you do need to reach out to me, I'm happy to help if I can. Wishing everybody the best, and thank you for attending.
Right. See you next time.
As Dr. Pilny said, thank you all so much for attending. We appreciate the questions, and please watch for a follow-up email from us in the next couple days. And again, thank you all for your time, and a huge thank you to our presenters for today. We're getting a lot of really nice thank you comments.
Yes, we are. Thank you very much, everybody.
Take care.
Thanks, everybody. Bye. Have a great day.
Bye.
Bye-bye.